your administration is about to go to the Supreme Court to argue to throw out the rest of Obamacare, which includes the protections for pre-existing conditions. So your administration is in court right now trying to get rid of that protection.
In order to replace it with a much better health care at a much lower price, I'm going to put it very simple. We would like to terminate it, and we would like to replace it with something that's much less expensive and much better. We will always protect people with pre-existing conditions.
But if you're successful in court in November, those pre-existing conditions, that promise will be gone.
Now, President Trump, as you can see, flailing there last night, and frankly, also lying when the topic turned to health care last night. I say lying because the folks over at PolitiFact say the president's claims about pre-existing conditions are pants-on-fire whoppers. Also, if Obamacare were repealed, it's estimated that more than 50 million Americans could be denied coverage by their insurers because of pre-existing conditions. Another 21 million, they'd lose their insurance altogether, and 12 million more could get tossed from Medicaid. Now, bear in mind, this is all happening, of course, in the middle of a pandemic that has already killed more than 218,000 Americans, with the deadly virus continuing to spread. Take a look at this interactive map from the Times. It shows the areas that have gotten hit the hardest. The U.S. now has more than 8 million people who have tested positive, included 65,000 in just the past 24 hours. Plus, the nation's leading public health organization, the Centers for Disease Control, is getting marginalized by the politics coming from the White House. ProPublica just published an extraordinary piece. It's called The Fall of the CDC, and it describes how the world-class organization has been, quote, brought to its knees by the virus and how its leaders have capitulated to the presidency. Now, the reporters, they obtained hundreds of emails from the CDC, including one that was typed out after the administration had bullied the center into loosening the guidance about how many people can fill the churches. And I'm quoting now, "I'm very troubled on this Sunday morning that there will be people who will get sick and perhaps die because of what we were forced to do." Other emails, they show career scientists saying the damage to the CDC could last for decades. Now, before I get to my first guest, I'm going to quote again from that piece. Employees spoke openly about their hill to die on, the political interference that would prompt them to leave. Yet again and again, they surrendered and did as they were told. It wasn't just worries over paying mortgages or forfeiting the prestige of the job. Many feared that if they left and spoke out, the White House would stop consulting the CDC at all and would push through even more dangerous policies. Let's bring in our guest, Kathleen Sebelius. She's the former HHS secretary in the Obama administration. She's also the former governor of Kansas. And let me just start from that piece that, by the way, I can't recommend more strongly enough for people to read about what happened at that agency. I believe if the polls are right, Governor, that a lot of people are going to, after the election, say, I really didn't feel comfortable about the things I was told to do, but I felt I needed to be there. I have real problems with folks, and I understand it's easy to say that from inside of a television studio when it's not my career, but a lot of people had a lot of choices. Maybe complicity is too strong a word, but to call out when something was wrong. And I know we see what happened to the Colonel Vindmans of the world who did that and paid a huge price. But, you know, while we're still in this moment and it doesn't become hindsight, shouldn't more people have spoken up over the years as agencies got marginalized and marginalized?
Well, again, it's hard to make individuals' decisions for them, but in the case of the CDC and some of the health agencies, we're talking about absolute life and death issues. And I understand the fear that people have that even more terrible decisions would be made, more misinformation. But I think it's incredibly damaging that the CDC's reputation as a gold standard in the world for public health has now been undermined, and the trust in the agency has been undermined to the point that it will take years, if not decades, to restore. So I think that, you know, in hindsight, it would have been helpful if more of the political folks would have walked out the door. The career scientists are doing their jobs. They are not the ones who are writing the misinformation. They're not the ones who are giving the wrong answers at press conferences and standing by the president's side when he says totally nonsensical things or totally dangerous things. But the layer of political people who theoretically know better and know more should have walked out the door and resigned.
With the ACA, and Lord knows all the years that you've put into helping making it what it is, but we all follow along with what happened in the nominating and now seemingly inevitable confirmation of Judge Barrett. I gave the numbers, but you can do better justice. Talk about what happens in the middle of a pandemic if we repeal the ACA, just the kinds of things that we now take for granted that people are all of a sudden going to be on their own for.
Well, Richard, I think it's a great question. And after a decade, the Affordable Care Act is sort of baked into the entire health system. It drives the reimbursement for Medicare, the program for seniors, as well as the fact that Medicare seniors pay lower drug costs if they take a lot of prescriptions because of the ACA. They have wellness checks that they now count on. They have an opportunity to have preventive care with no cost sharing, like everything from colon cancer and mammogram screenings to flu shots and vaccinations. That's in Medicare. Medicaid has been greatly expanded in 37 states in the country. And not only would millions of people lose that health insurance. These are lower income workers whose families depend on health insurance, who are often our essential workers at the front lines. They would lose their health insurance, but more than that, 37 budgets across this country in states would be blown up because Medicaid is the largest transfer of federal dollars to the states. And if you took away that money, you would suddenly have a catastrophe on top of what is already reeling state budgets. But you played the clip with Savannah Guthrie questioning the president, who has continuously lied about having a health plan. If you recall, he's been saying this since he ran for office. He would have better and cheaper health insurance available for everybody. We have never seen it. It's still a secret plan. The Republicans in 10 years have never put forward a plan. They absolutely have no way of protecting people with pre-existing conditions. And unfortunately, every Republican in the country runs on that same promise. I was an insurance commissioner for 8 years in Kansas. I regulated a marketplace where I watched insurance companies each and every day play by the rules before the Affordable Care Act, which meant that they could deny people coverage, they could limit the kind of coverage, they could price people out of the market, they could dump people out of the market. And it happened over and over again until the law changed.
You know, my wife works in a hospital, and she pointed out something to me I didn't realize. She said, do you imagine if the ACA went away, what happens to hospitals? In the middle of a pandemic, we were always the place of last resort. When people didn't have insurance, they came to the emergency room because obviously we never turned anyone away. In a pandemic with hospitals already hemorrhaging money right now without any state aid to subsidize, you're going to have ERs with people coming in with COVID and people coming in with all other medical needs. I mean, how this compounds the insanity with more than 2/3 of this country now supporting the ACA, it just borders on, just mind-boggling insanity.
Well, and just take COVID itself. So the ACA will make sure that vaccinations are free for everybody. Once we get a safe and effective vaccine, they'll make sure that people with insurance coverage can pay for their treatments, can pay for that hospital stay. The law makes sure that if you have COVID and survive it, God hoping, that you won't be kicked out of your insurance policy or charged more or limited in your coverage. So there are, incredible ramifications of just this one health issue. I live in a state which unfortunately still, in spite of the governor's wishes, in spite of the legislative majority, has not yet expanded Medicaid. We've had 3 rural hospitals close, and in each case, the CEO said, a large part of this is because of the uninsured care still coming through the door, because Kansas has turned down literally hundreds of millions of dollars that could have come from the federal government. That will be every state in the country. Every state in the country will be reeling because bills that can now be paid, doctors and healthcare providers who can now be paid, hospital bills that can now be paid, will suddenly be charity care once again. And there's no state that can possibly fill that gap because all the state budgets have been ravaged by COVID. So we're talking about another economic catastrophe of major proportions just with the Medicaid part of the plan.
Hopefully, November brings change. And speaking of your state in Kansas, I'm curious the sense you get. I've looked at the polls, and specifically in the Senate race where things stand right now. Democrats clearly have scars to prove it from looking at the polls 4 years ago at this time and how things turned out in November. But nonetheless, using Kansas as a barometer, what clues can you get as to what's going to happen in less than 20 days?
Well, we have a Senate candidate who is running neck and neck with her Republican opponent in an open seat. That's phenomenal because the Democrats have not elected a senator since in 80 years, 8-0. So the fact that in a presidential year, which usually provides a lot of Republican cover, that we have a essentially tied race is remarkable. And the Senate Democratic candidate, Barbara Bollier, who is a doctor and would be the first woman doctor ever elected to the Senate, has outraised her opponent in each of the last three quarters. Also remarkable in Kansas. I think it's likely that Donald Trump would still be able to win in Kansas. I don't think there will be any coattails, and if anything, he will have a negative drag on people up and down the ticket.
Governor, I appreciate, as always, you giving us a few minutes here. Thank you so much.
Good to talk to you.
All right, folks, when we come back, stimulus talks in Washington. And obviously, stimulus would be so critical for so many millions of Americans here struggling to pay their bills. After the break, a congressman representing thousands of people who need such help. He'll join us to discuss where that relief negotiations now stand.